Hello everyone, I'm Dr. Anuj Chawla. I'm a foot and ankle specialist working at CK Birla Hospital, Gurgaon. So today we are going to talk about ankle pain and what are the possible causes and what are the possible treatments. So if we talk about ankle pain, we can divide it based upon the location of the pain, or we can divide it based upon the causes of the ankle pain. So if we look at this foot model, pain in the ankle can happen in the front, it can happen on the outer side, it can happen on the inner side, and it can happen at the back of the ankle. There are different reasons for each and every type of ankle pain. So if we talk about the most common reason for the pain is the outer side of the ankle, which happens due to a lateral ligament injury, yani ki after an ankle sprain. So after a twisting injury to the ankle, the ligaments get ruptured, and that leads to pain which can happen on the outer side of the ankle. Most of the times the treatment for such cases would be rest, ice, compression and elevation, which means rise, and then some physiotherapy and rehabilitation. In a few subset of the patients, if the pain does not get better with the traditional or with the non-operative treatment, then we might have to even think about surgery. So similarly, when we come to the front of the ankle, the pain can be due to various causes. In the younger people, sometimes it can be something which is related to impingement related pain, in which what happens is that the soft tissue or bone in the front becomes a bit more, it grows a bit more, and that leads to pain and stiffness in the front of the ankle. Most of the times medicines, physiotherapy and sometimes even injection can help in relieving the symptoms, but in certain cases again a surgery, which is a keyhole surgery to clean up the ankle joint, is being done. Front of the ankle pain can also happen due to some cartilage disorders, which are normally called as osteochondral lesions. Those patients, normally if the symptoms are significant, they most of the times need some form of surgery to clean up that cartilage defect. Similarly, when we come to the inner side or the medial aspect of the ankle, most of the times the pain can arise either from the ligaments, which is the deltoid ligaments, or in the tendons, which is the tibialis posterior tendon on the inner side of the ankle. In such cases, generally the treatment initially involves rest and medicines. But yes, if the treatment is not effective, then maybe further investigation and then according treatment has to be done. Another very important part or very important subset of patients with the ankle pain is those which come at the posterior aspect of the ankle or at the back of the ankle. So back of the ankle, the most common area of involvement is the Achilles tendon, which is at the back of the heel, and it is the strongest tendon of the body. So Achilles tendon pain generally happens in runners or in middle-aged sedentary people who are involved in a lot of activities, but only in few days of a week, mostly in the weekends. So Achilles tendonitis most of the times is treated with rest, medicines and a proper physiotherapy regime, and in a very few subset of patients again a surgery might be needed if all these things are not successful. Posterior ankle pain can also arise from certain thing called as posterior ankle impingement. What happens in this is that there might be either a bony growth or soft tissue growth at the back of the ankle, and the bones of this bone called tibia and the heel bone called calcaneus rub against each other, especially during the toes pointing down or the extreme plantar flexion. It is more common in footballers and specifically in ballet dancers. So if you have this problem, many a times there can be some tendon problems over here or an extra bone over here, which is called as os trigonum. If something like that is there, most of the times a small surgery using keyhole technique or an arthroscopic surgery is needed to cure this condition. So if you think that you're suffering from an ankle pain, do come to us and take an appointment. Thank you very much.